Now, let's welcome Dr. Richard Thompson of Novant Health OB/GYN. Dr. Thompson, welcome to the show. It's so good to have you back.
Yeah, thank you for having me.
It's always fun when you're here. Well, I know most people out there have met you or know of you, so just remind me a little bit about where you went to school and maybe where you did your residency.
I am from Virginia. I grew up there. I went to medical school in VCOM, Virginia College of Osteopathic Medicine, which is affiliated with Virginia Tech, and then moved here to the Wilmington area, did residency in Wilmington at New Hanover Regional Medical Center, and then from there moved to Novant Health and started working in Bolivia.
Yeah, awesome. Well, tell me a little bit about your practice. It's Novant Health OB/GYN, correct?
Correct, yes. We currently have 4 physicians, a midwife, and 2 nurse practitioners. We offer the full range of OB/GYN care, everything from delivering babies to annual exams and surgical interventions for various different issues. And we have 4 different locations.
Yeah.
Our main office is in Bolivia. We also have satellite locations in Calabash, Southport, as well as Leland.
Yeah, that makes it really convenient for our patients.
Yeah, we try to offer multiple options.
Right. Well, today we wanted to talk to you about COVID-19 vaccination and your personal choice around the vaccination. I know that it had an effect on you, and you were recently vaccinated, correct?
Correct, yeah.
So what did it mean to you personally to get vaccinated?
Well, to me, the biggest thing was I felt like gave me a sense of protection for my family personally, as well as patients, out serving the public and patient care. We certainly don't want to act as a vector for spreading COVID, and receiving vaccination really helps limit that chance.
Yeah, you're around so many patients and babies and this and that, and your own babies.
Oh yeah, yep, for sure.
Yeah. Well, I've talked with some healthcare workers, and they say they felt like it was a really historic moment when they received the vaccine, and kind of even emotional about it, about that whole process. So how was that moment for you?
I would characterize it as a huge sense of relief, just to know that, again, going back to the safety aspect was huge for me, and also just knowing that we're on a path to getting the country hopefully back to where we were, this time last year, year and a half ago.
Yeah, and really by getting vaccinated, you're participating in that process of getting back to whatever that new normal is.
Oh, yeah, most certainly.
Yeah. Did you have any hesitations or concerns personally about getting the vaccine?
I had concerns, but they weren't big. I mean, mine were mostly related to immediate effects after the vaccination, as far as, most people have heard about muscle soreness, fatigue, those sort of things. I had talked to several people who had actually participated in vaccine trials and were told that they received the vaccine during those trials, and they said their effects weren't that great. So I felt pretty comfortable moving forward.
So what would you say to viewers out there who might have some concerns about getting vaccinated when it's their turn? Would you be encouraging to them?
Oh yes, most definitely. I mean, my experience was fine with the vaccine. I didn't have any ill effects, not even immediate, no fevers.
Nothing?
No muscle aches, no fatigue, nothing of that nature.
You probably worked the next day.
Yeah, yep.
Well, I know that you care for new moms every day, and I know it's got to be scary. It must be scary to be pregnant during these times. Are you recommending to expecting moms, what are you recommending to them to stay safe during COVID-19?
Well, we're recommending pretty much the same thing that is being recommended to the general public. Wear a mask, socially distance, keep your hands clean, try to avoid public interaction when you can. Those are the biggest things that we're recommending.
So pretty much it's the same whether you're pregnant or not. It's the same recommendations. I was thinking about expectant moms who are healthcare workers, and they have that option to take the vaccine. what would you recommend? Would you?
We are going right along with what the American College of OBGYN states, which is that pregnancy you shouldn't avoid receiving the vaccine because you're pregnant. If you choose to receive the vaccine and once your time comes to receive it, whatever group you fall in for that, for the vaccine, that you should receive it at that point.
Should take advantage of it, yeah. Wow.
Yeah.
Is there anything else before we close that you'd like to add?
No, just everyone stay safe and do everything you can to decrease the spread and keep yourself and your family safe.
Yeah. On a side note, are you taking new patients?
Oh yes, all the time.
Great. Good to hear that. All right.
Yep.
Well, thank you so much for being here. It was great to hear your story.
Yeah, thank you for having me.
You're welcome.